Are people coming to you knowing they have a hormonal imbalance, or is that something they're coming to you with some symptoms and you're figuring it out?
Yeah, that is something that's usually not diagnosed for sure. And you can see conditions with skin conditions, acne, really bad PMS, fertility. It can be a variety of things. And that's really where we can piece it together and find a hormonal imbalance for sure.
Mm-hmm.
Yeah.
How many hormonal, I don't know anything about hormonal imbalance.
Yeah.
Are there many different things that could be out of balance?
Yeah, absolutely. Mostly, I think I've only ever seen women for hormonal imbalance, but it can be excess testosterone, it can be imbalance of estrogens, progesterone, it can be a variety of things.
Mm-hmm.
Yeah, and there can be fibroids. You can find all kinds of different things going on for sure.
Mm-hmm. So then what do you do about it?
So that
Depends.
depends. I feel like that's
We
my
could spend
answer
an
for
hour
everything.
on every topic.
It depends. Yeah, absolutely. And that's the beauty of naturopathic treatment is there's just no one size fits all for everybody, and we have so many tools in our tool belt. So it really depends on what's going on, but we have a lot of incredible herbs and supplements that help really gently rebalance hormones, help with PMS, help with skin conditions, help with pretty much everything. Menopause is another big one that I see quite often. So, yeah.
How would, when you discover a hormonal imbalance, how would what you do differ from what a conventional doctor might do? Is there a big difference there?
I would say, there's a big difference. We try to move very gently and not make it very extreme. And we use, I use mostly herbs. I use some acupuncture sometimes.
Would a conventional doctor be prescribing synthetics?
Often, they often do synthetics. And I find that when you use more herbs, it's just a little bit less dramatic. It's just like a very subtle. I'll find that for menopause, for example, I've had great success with fewer night sweats and irritability, and everything just kind of smooths out gently. And then it's a nice transition into full menopause rather than just an extreme. Yeah.
Cool.
Yeah.
Okay. I guess, again, since this topic is so broad, do you have examples of how you've been successful helping patients with this in the past? I guess menopause you just talked about. Is it a common one?
Menopause is a very common one, and I have had some great success. I had one patient recently who said she was waking 10 times a night, just drenched with hot flashes. And we put together a protocol, and she said she was maybe waking up once a night, which is pretty dramatic. It affected every aspect of her life. She was well rested. She was able to have a healthy lifestyle the rest of the day, whereas before she said she felt like a walking zombie all the time. Yeah.
That's great.
Yeah.
Yeah.